Good afternoon, ladies and gentlemen, and welcome to the Portland School District Podcast. We're live here at the Town Tech Educational Podcast Studio at Portland High School. I'm your host, Dave Kuzminski, and with me in the studio is our Superintendent of Schools, Dr. Charles Britton, and this is going to be the first podcast of the new year. So welcome, Charles. How are you?
Good. It's 2021, thank goodness.
We ushered 2020 out the door.
Yeah,
My God.
brilliant.
And it was a long 2020.
It was a long 2020. How surreal was it to see no one in Times Square?
That was really surreal.
Wow.
That was really, really surreal. And, to the point of, I'm sure cleanup was a lot quicker this year.
Yeah, I mean, it's funny how this comes home, hits home in different ways.
Yeah.
And that was one of the things, New Year's Eve, that I was like, oh my goodness.
Yeah, normally there are a million people.
Millions
And,
packed in there.
yeah, it gets crazy. It gets crazy. Anyway, so how was your New Year's? Was it quiet? And did you get to see the ball drop?
Yeah, we did some Zoom family get-togethers.
Nice.
But we really stayed together, and I guess there's a value in not bouncing all over the state to visit family, and
Absolutely.
but I miss it, honestly.
For sure.
I can't wait till next year.
Yeah, next year we can get to the point of hopefully not wearing masks and not socially distancing and giving hugs and all that kind of good stuff. So anyway, so what's new in the district? I know we just came back to school. The school was out over the Christmas New Year's break, so we're back in. We are still remote. Is that correct?
Right. So I'll just make sure everybody knows where I'm recording this with you on Monday, January 4th.
Uh-huh.
Sort of, I guess, changes are like the New England weather. If we
Wait 10 minutes.
Wait 10 minutes, right? So I met this morning with the district leadership team. I have a meeting tomorrow with the Portland Reopening Committee, and then a Board of Education meeting tomorrow night, the 5th, January 5th. At that meeting, I will be making a recommendation to the board that reflects what we're headed towards. So we are still remote this week, and based on my conversation with the leadership team today, I see us heading towards a recommendation that will have us reopening for in-person learning January 11th.
Okay.
So let me just kind of reframe how we got here, the gut punches we took that put us in remote, and how we're now picking ourselves up, dusting ourselves off, and we're going to get back on the horse, right? When you fall off, get right back on. So the bad news is that the infection rates, in Middlesex County are still over 50 per 100,000 now. And the town of Portland, they're over about 45, 46 was the last number I saw, which is, reflective of a lot of virus out there.
Yes, still high. Yeah.
It's still high. We all, in our dream world, we would not have any, but certainly way, way lower than we are now.
Mm-hmm.
What does that mean? That means that when we reopen schools and the numbers are that high, it's not really a question of if we'll have positive students or teachers or members of our faculty staff in the schools. It's almost a question of how often and how many. Right?
Mm-hmm.
So that's certainly alarming, and a lot of people will hear that and go, oh my goodness. But that's the bad news, right? The good news, though, is that our health department continues to tell us that there are not widespread outbreaks in schools, right? That as long as we implement the mitigation strategies of cohorting and mask wearing and sanitizing and social distancing, that we would not see large numbers of outbreaks or cases being spread in our schools. So if we were to reopen, that would mean we have to, of course, implement those strategies to the greatest extent possible, right? Now, what happens, though, is it's still an expectation that if a student or somebody who is a known positive case comes into the building, either before they're symptomatic, or maybe they're asymptomatic and don't know they're positive, that anybody who is within 6 feet of that student, generally for more than 15 minutes, is going to be expected to quarantine. Now, the first time around we were dealing with this, those quarantine periods were 14 days, which is a long chunk of time. Right?
Yes, yes.
Those quarantine periods have now been reduced to 7 days with a negative test after the 5th day of exposure to someone who is known positive, or 10 days without a test. Now, when you come back after the 7th day or the 10th day, it's still be very mindful of your well-being until the 14th day is over. You're not completely out of the woods,
Sure.
but the chances that you are positive at that point are reduced to the point where the health officials say you can return to work or school. So that's helpful because it would mean that we're not covering teachers for long periods of time, and or principals or bus drivers or secretaries or paraprofessionals or anybody else for long periods of time. Because that's what really put us on our butt the last time, was that we didn't have the staff to cover the large numbers of quarantine requirements.
Right.
So that number's been reduced. In addition, I am delighted to report that the Portland community, which I think is a tremendous reflection of the sense of community spirit out there, responded assertively to our pleas for additional substitute teachers. That, in combination with the governor's waiving the requirement that you have a bachelor's degree, has enabled us to build a pool of substitute teachers that's reached about 25 individuals now.
Good.
So this Wednesday this week, we've put them through all the background checks over the past 3 weeks, and we're doing some training with them this Wednesday. But the reduced quarantine periods and the larger number of faculty of substitute teachers has positioned us where we could give it a try again and absorb the ongoing effects of large numbers of positive or large viral loads in the community.
Okay.
The high rates. So we're going to try again, right?
Sure.
We're going to reopen, and we're going to implement our mitigation strategies fully, and certainly hope that we have few instances of individuals who are positive, either pre-symptomatic or asymptomatic, in our buildings. But when that happens, we'll contact trace and we'll respond appropriately, and we'll have the substitute teachers and have the capacity to continue in-person learning without having to, shut down regularly.
Sure.
As we were, in November. So what I think that, again, I'm talking Monday, the final decisions are being made today and tomorrow as I engage all of our stakeholders in these discussions. But it looks very likely that Valley View, Gildersleeve, and Brownstone will reopen fully.
Okay.
The question is about the middle school and high school. It is very likely that the middle school and high school will open for in-person learning. It has not yet been decided whether that will be hybrid or full.
Oh, okay.
If it were to be hybrid, it would be for 2 weeks to sort of step down or step up
Okay.
towards full, so we can sort of absorb the impact maybe of the post-holiday surge or other things. But it may be likely that full reopening K-6, hybrid reopening middle school, high school for 2 weeks, and then full reopening middle school, high school if things go the way we hope, which is that we don't have large numbers of individuals subject to quarantine periods.
Sure.
Or sick.
Well, that's a good thing. So I think, from a standpoint of, because when we initially came back at the beginning of the year under the hybrid mode, and I think that worked reasonably well.
Yeah, what's interesting is, we're reaching a point where we can almost be reflective.
Right. No.
Maybe this summer we'll have a chance to sit down and
Do a hot wash.
Right, yeah, I do hot wash, kind of write a few memoir or chapters for our memoirs. But let's not forget, we opened in September in hybrid because at that time we were all terrified that schools would become super spreader events. Right, we had no idea. Schools closed in March and had not reopened until September, and it was, hey, do we fully reopen the doors and have everybody come in, or do we open in hybrid, reduce the numbers, and examine and learn with the rest
Sure.
of the state and frankly country and world if schools prove to be safe places?
Sure.
I think what the Department of Public Health and their epidemiologists and researchers and doctors have studied very carefully and have found that schools weren't those super spreader events.
No.
Frankly, if I could beam my brain back to September, we could have fully reopened.
Correct.
And not had that fear that we would be super spreader because the mitigation strategies work.
Correct.
Now we know that now.
Yeah.
The things we had to learn, unfortunately, we learned them the hard way, and I think a lot of people did, was how the effect of quarantine and contact tracing would impact our staffing, our ability to have adults present in the building to teach and supervise students. And that was something that we learned is very difficult when it's a 14-day quarantine period, and the impact of high community infection rates comes into the school. So that's where we are.
Well, I think, realistically, statistically speaking, I think it was proven that, the spreader events were more out in the community, okay, rather than in the school. And I think the schools proved to be a overall safer environment, and so forth.
Yeah, and I mean, look, I don't have the right letters after my name to say with certainty, except that the people who do have those letters after their name predicted a surge after Thanksgiving, which we saw, and they're predicting now a post-holiday surge, which we will know if we'll see over the coming weeks.
Sure.
But that's because those events, those community times when people get together and eat and laugh and are merry, are times when people likely let their guard down.
Yes, yes.
In schools, we generally don't let our guard down.
No.
That's one thing we're very good at
Correct.
is knowing what the rules are and enforcing them.
Sure, sure. Now, from a standpoint of the rest of the extracurricular activities, I assume that's still going to be on track with no fall sports or spring sports.
Yep. So that's an interesting question. That's going to be the next river to cross. There are no winter sports right now as a function of executive order, right? So all public school and community-based athletics, primarily in winter, it's basketball, but there's also wrestling and cheerleading, and indoor track are on hold. I believe the date was till January 16th, although the 19th may be ringing in my head now. We're going to wait until we get a new dispensation from the executive and guidance from local health, and hopefully in collaboration with the CIAC. What we were seeing before the executive order was that sports that were classified as high risk were not recommended. Here at Portland, that meant wrestling and cheerleading. Sports that were classified as medium risk, which are basketball and indoor track, would be acceptable if the athletes wore masks during those events. And a lot of us were wondering how comfortable or healthy it would be to wear a mask during a highly aerobic activity like basketball. And we never really had to answer that question because we were told
Just never happened.
never happened. So that's still an area that is going to merit conversation.
Sure, sure. Well, and the good news, obviously, now since I think we've had our last podcast is, we have now 2 vaccines out on the horizon, so those are being distributed. We have vaccinations going on, which is a good thing. I think we had Russ Melmott on last week, and he was explaining about the VAMS program, which is the vaccination. I can't the acronym, but
It's a vaccine administration management system. I learned about it today, kind of the hard way. We registered our folks today. I thought it was just registering.
Yeah.
We weren't supposed to have. But, we're really only supposed to be registering for the school would be our nurses. Right?
The nurses, okay, not the teachers.
Not the teachers yet.
Yeah,
It's still, they're still getting through it. And certainly it makes all the logical sense in the world to me that you would have different tiers of folks. And now it's
Your first responders and
doctors, nurses, police,
and so forth. Sure.
And then the second tier would be the healthcare. I mean, childcare providers, teachers,
Right.
Bus drivers,
Yep.
grocery employees.
Sure.
The essential workers. So
Essential.
you have frontline and then essential, and then from there, I imagine it shakes out to they'll look at age groups or different categories. So hurry up.
Yeah.
It's
Well,
like, let's go.
the vaccines are being distributed. I know the health center in Middletown, I think, I believe they just took delivery of some. I think Chatham Health took delivery. I think they only have 100 right now that they, I think, took shipment of as far as that goes. So they're getting those Tier 1A, employees, first line workers, registered, and then, we're going to be scheduling a vaccination inoculation from what Russ was saying in the near future to get that going. So, hopefully that's going to stem the tide and, hopefully get this pandemic in our rearview mirror to the point
That's the only thing that's going to do it. I mean,
exactly.
That's it. Let's get those. I'll take one in each arm and one in the leg, please. Right?
Exactly.
Let's get this
you
going.
I mean, there was a little apprehension out there, and I think that is being, through education and so forth, that is being, I think, stemmed pretty well. And I think people are now more willing, as far as that goes, to be for the vaccinations and get those inoculations and, like I say, get those antibodies in so we can, like I say, put this thing behind us. So, which would be good. So, all right. Well, that's gives us a pretty good idea. I know you guys are going to be having a board meeting tomorrow night.
Yep.
As far as that, and then we'll look. Hopefully, we can get things back. To some sense of normality and get things reopened to the point where we can get. I know from the standpoint of the students, I think it's the in-person learning is so important, especially in the lower grades.
Yeah,
that's becoming evident. The COVID burnout and the screen time. Sometimes you get deer in the headlights.
Yeah, I'll be. No one in their right mind would ever suggest that online learning is preferable, maybe even until college level, right? I mean, I think that many colleges, even before the pandemic, were transitioning to online learning. Maybe I think there might be an argument for high school level online courses. I know the Connecticut Virtual High School is something that's been around for quite a while now, but certainly below. I'll even go so far as to say 8th grade, totally not what we want to be doing with our kids.
Right.
And
no, they need that interaction.
Right.
Of course. As far as the support from the teachers and just the social ability, with their, their peers, and it really makes a difference. And I think, from not only their physical health but their mental health, because there certainly is an effect on mental health. Not only in a student level but also parents. I mean, dealing with healthcare issues. Some parents are working from home, some are not working. So I mean, that certainly is putting a stress on the family environment.
Mine included. My son's been remote learning for several months now. My daughter's still been in. But occasionally now, it's awful. It's not what we want to be doing for sure. That said, it's we're trying to make lemonade out of lemons, and thank goodness this is a once in 100-year, please, event, right?
Exactly.
But hey, we will. Every crisis that I can think of in our history. Right.
Sure.
We've come out of better.
Oh yeah.
And I think I imagine when you're in the middle of it, it's hard to see that. But
right.
I'm already speaking with my leadership team and people who I consider close colleagues, that there are a lot of silver linings that are going to come out of this.
Oh, absolutely. And I think, our community has come together. Your administrative team have done, phenomenally, dealing with this whole issue of, when we started out in the gate in March, and how we were going to get this done and so forth.
Yeah.
But, we rose to the occasion, and I think we're well on our way. And like I say, I think there's a light at the end of the tunnel. We have a vaccine, which is good. We get the inoculations and the vaccinations in arms. I think that's going to be a good thing. So anyway.
Yeah.
All right. Well, thank you, Charles. I appreciate it. And I think that brings our episode number 9 to a close. And again, this is our Portland School District podcast with Dr. Charles Britton, our Superintendent of Schools, giving the update. I'm your host, Dave Kuzminski. And as I always close all our podcasts, okay, if you can, stay home, stay safe, wash your hands, and please wear your mask. So we'll see you soon. Thanks. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.